All right, so this is part 3 of the introduction to musculoskeletal system. We're going to talk about muscles. All right, so hello, Mr. Computer. All right, there are 3 types of muscle tissue, and you'll be talking about these in histology, or maybe you did this some already. They're skeletal, cardiac, and smooth. We're not really going to deal with cardiac and smooth in this course. We'll talk about them more in the winter. Cardiac is the muscle of your heart, and smooth is the muscle around glands and organs that help them move around, squeeze and digest food and so forth. We'll be discussing mostly skeletal muscle, and skeletal muscles are those voluntary muscles that you move. This is that you move, and here we can see lots of skeletal muscles here on Arnold Schwarzenegger back when he was Mr. Universe, Mr. World, whatever it was. And then remember, he became the Terminator in the Terminator movies. And then after that, he was the governor of California, and I'm not really sure how those things are all how they all fit together, but there it is. Anyway, so we're going to be talking mostly about skeletal muscle. You'll learn more about skeletal muscle in histology. Skeletal muscle is going to have lots of connective tissue wrappings that wrap around them. So here's a femur. Hopefully you can recognize that by now. And here is a muscle, maybe a quadricep, attaching to the bone. Here by the greater trochanter. Sorry, I momentarily got distracted. I'll try not to let that happen again. Anyway, so muscles are going to attach to bone via tendons. So basically what happens is all these connective tissue wrappings around individual muscle fibers, groups of muscle fibers, or the big connective tissue wrapping that wraps around the whole muscle, which is called deep fascia, all kind of join together to form the tendon. And the tendon attaches the muscle to the bone, so that when the muscle fibers contract, they pull on the tendon, and the tendon pulls on the bone, and that causes the bone to move. And that's how joints move around. All right. So I'll be talking a little bit in class about deep fascia, because deep fascia helps muscles to slide over one another. All right. Muscles attach to bones, and then when muscles contract, they're going to pull on the bones. All right. So, and the places that the tendons attach to the bones, they have names. Those are those little bony markings that we've been talking about. So when we talk about specific muscles, we need to talk about the places that they attach to bones, and we need to describe those places, like the greater trochanter or the linea aspera or so forth. All right. So, and those places where tendons attach to bones, or where muscles directly attach to bones, are called attachments. In your textbook, these attachments of muscles are described as proximal and distal, and that if we look here at the upper extremity, here's the shoulder, and here's the elbow, and we look here at the biceps, this here would be the proximal attachment, and this down here would be the distal attachment. And that makes a lot of sense to me. A lot in the physical therapy world, they often use proximal and distal attachments as their descriptions. The other way that attachments of muscles are described is what's called the origin and the insertion. Right? And when we look here at our biceps brachii, right, the proximal attachment here is the same thing as the origin, and the distal attachment is the same thing as the insertion. So the definition of the origin is the bony attachment at the stationary end of the muscle. All right. So when this biceps brachii contracts, it's going to move this bone this way. So this attachment here is the one that's moving, and this attachment here is the one that's stationary. And if you need to prove that to yourself, you can kind of move your elbow around. So this attachment is the origin of the biceps brachii, and this attachment is the insertion, the bony attachment to the mobile end of the muscle, the insertion. I will probably use proximal and distal in class because it coincides with your textbooks, but you should be aware of what origins and insertions are and be able to use them as well. The belly of the muscle is just this part in the middle between the two insertions, between the two attachments, sorry, that is basically where all the muscle tissue is. So that's the belly of the muscle. Here's just a reminder here, ligaments, we already talked about those, go from bone to bone, and tendons are going to attach muscle to bone. Okay. All right. So then let's talk about muscle actions. And you can, when you read about muscles, for example, when we're reading about the biceps brachii, you're going to read where the proximal and the distal attachments are, and then you're going to have a whole list of actions. All right? Now, you can memorize these actions, or you can learn to start thinking about these actions. So, so this slide here is going to lead you through how to think about the actions of these muscles. All right? So you can think about them instead of just memorizing them. And that's a much more long-term solution to understanding and building those mental models of how muscles work. All right? So it will help you get away from just memorizing them, and it will help you remember them in the long term. Right? So put yourself in an anatomical position and look at your biceps brachii. That's going to be the bulging muscle on the anterior side of your arm. All right? So ask yourself, where on the body is this muscle? Is it on the anterior side of the arm, or is it on the posterior side of the arm? Okay? If it's on the anterior side of the arm, it's going to be able to do different actions than a muscle that's on the posterior side of the arm. A muscle that's on the anterior side of the arm is going to flex the arm, the elbow, all right? A muscle that's on the posterior side of the arm is going to extend, right? If you just look at these muscles, you can see, right? If this muscle here is contracting, it's going to pull the radius and the ulna, the forearm, this way, and that's a flexion, while this muscle in the meantime is stretching out. Now, if you want to extend the elbow, the muscle on the posterior side of the arm needs to do that. All right? So the next question to ask yourself about a muscle is, which bones does the muscle attach to? Does it attach here to the scapula and the radius and or the ulna? All right? And if it does that, and it's on the anterior side of the arm, then it's going to move the forearm. It's going to move the elbow. All right? And ask yourself another question, which joint or joints does the muscle cross? All right? In order to move a joint, a muscle needs to cross that joint. So for example, you can see here the biceps brachii crosses the shoulder joint, so we can act on the shoulder joint, and it crosses the elbow joint, so we can act on the elbow joint. This muscle here, which is one of the heads of the triceps, crosses the elbow joint, but it does not cross the shoulder joint. You can see that here. So this one head here of the triceps is not going to act on the shoulder joint, but it's going to act on the elbow joint. So in order to act on a joint, a muscle must cross that joint. And that's all listed here. All right. Then ask yourself, all right, so I know that this is the biceps brachii here on the anterior side of my arm. It's going to cross the shoulder joint. It's going to cross the elbow joint. And then when these muscle fibers here in the belly contract, what's going to happen, right? When these muscle fibers here shorten, what's going to happen? It's going to pull the forearm this way. So it's going to flex, okay? So by going over these kind of simple rules here of how to describe muscle position, where they attach, what joints they cross, and what's going to happen to them when they contract, it'll allow you to kind of work through muscles without memorizing exactly what they do in a table that's filled with lots and lots of words, all right? Alternatively, you can have that table in front of you, right? And you can kind of go through each of these muscles, all right? So it's gonna, and you can feel it. It's gonna attach to my shoulder. It's gonna attach to my radius and or ulna. And then when it's on the anterior side of my arm, and when I contract it, it's gonna pull my forearm this way, and that's a flexion, right? So try to do that a little bit. Try to think about muscle actions instead of just memorizing them. It'll really help. So here I gave you a few in the leg this time to kind of think about, all right? here's the pelvis, here's the femur, and this group of muscles here are they attach to the pelvis, that's their proximal attachment, and their distal attachment is here on the femur. You notice also that one of these, its distal attachment is here on the tibia. All right. So what I want you to ask yourself is, when acting on the hip joint here, what are these muscles going to do? All right. When these muscles contract, are they going to adduct the femur, or are they going to abduct the femur, or can they do both? And then ask yourself, oh, I definitely see that it's crossing the hip joint, but I can also see that this one muscle here crosses the knee joint. Well, what's it doing to that knee joint? And is it all of these, or is it just this one? All right, so these are things to think about. See if you can answer those questions. Here's another muscle. This is one of the quadriceps. So we're looking at the anterior thigh region here. Here's our femur. Here's our tibia. Here's the kneecap or the patella. And I want you to kind of go through the same thought process about this muscle here. What are its proximal attachments? What are its distal attachments? Is it on the anterior side of the leg? Is it on the posterior side of the leg? When this, which joint or joints does this muscle cross? And so what action is it going to have on that joint? So see if you can do that. So those are just a couple examples to kind of help you through this thought process. A few other things about muscles is muscles work in groups. All right, so there's going to be a prime mover of an action. So let's go back to elbow flexion here. So when we're going to flex the elbow, that's moving the elbow, decreasing the angle in the elbow. We're going to move the hand this way. There's a prime mover that does that. The prime mover or the agonist that's going to do that, and that's the biceps. All right. There are other muscles that can help do that as well. And there are other muscles that can do that as well. The prime mover is the main one that's going to do that. And then there's going to be some synergists that are going to help as well. That's what's listed here. So the prime mover or the agonist is the primary muscle in a movement, and it can be stabilized or assisted by other muscles. The antagonist is the muscle that's on the other side of the bone that's basically got to stretch, right? So when you're flexing your elbow, your biceps is contracting, but your tricep needs to stretch, right? And that's the agonist. So it's opposing the movements of the prime mover. Antagonists don't, always just stretch, but they have important functions in stabilization of bones and joints when you're moving them around. But I think just to get this definition straight, that when you're flexing your elbow, the bicep is the prime mover and the tricep is going to be the antagonist. Okay? When you're extending the elbow, the tricep is going to be the agonist or the prime mover of elbow extension, and then the bicep is going to become the antagonist. Right? So those are kind of some definitions to sort of become used to. You'll be using them in clinical skills, maybe you already have, and then you'll be using them in this class as well as with in the lab class. All right. So I think that's all I'm going to do in this video. I'm probably going to make one more little video that will be optional in case you want a little bit of help in thinking about how muscles are named. But that's it for this one. Hopefully that helps you at least a little bit. And that's all I got.